There are signs of hope today in the global fight to contain the coronavirus. The U.S. could have a third vaccine available to us in just weeks. Johnson & Johnson has submitted its single-shot vaccine that is 85% effective against severe disease for FDA emergency use authorization. The company has said it expects to supply 100 million doses to the U.S. by June. Meanwhile, researchers say AstraZeneca's vaccine is an impressive 75% effective against the highly contagious UK variant, and it might also prevent transmission. Experts continue to remind us that vaccines are key to stopping the spread and getting back to some normalcy. Case in point, New York Times projects the UK, with one of the fastest rollouts in the world, could blunt the virus in weeks. At this pace, it could give its entire population the first of 2 doses by the end of June, and significantly drop the number of deaths even sooner than that by first vaccinating its most vulnerable citizens. Joining us now, MSNBC medical contributor Dr. Kavita Patel, former Obama White House health policy director. I don't remember the last time I read the COVID section of the newspaper and smiled, but these reports about the public health side, obviously saving one life is the purpose of the vaccine, preventing disease. But when you pull out and look at big parts of the population seeing the spread significantly down, that seems to be the way that the vaccines get us back to something resembling normal.
Yeah, absolutely, Nicole. And you're right. It was a lot of good news, even coming out of Israel, where over 90% of the population over the age of 60 has already been vaccinated. Remember, they're using the Pfizer vaccine there. They've already seen a 41% drop in cases and hospitalizations. So there's incredible encouragement that even when you have kind of segments that are high risk, like in the United States over the age of 65 or people with chronic conditions, that if we can get a large number of them vaccinated, we are going to see continued decreases. And we're already seeing early signs of that in nursing home populations, by the way.
Dr. Patel, talk about the Johnson & Johnson vaccine. Will anyone still just get whatever's available, or do you think we'll start to see vaccines targeted to different parts of the population?
Yeah, I do think that there is a role in a one-shot vaccine that could be targeted to parts of the population where it is really hard, Nicole, to follow up. The way that I've been following up with people is by email, and not everyone has that. So if you've got a more transient population, we can do this with people who might not have housing that's regular. We can do this in the correctional facilities, Nicole, where we are still seeing kind of super spreader outbreaks and unfortunate deaths. So a one-shot strategy, don't get me wrong, I think anybody who gets any vaccine should take what they get, but we can definitely be tactical to help, especially where we don't know if we can get that all-important second shot. But I do want to reinforce the data all around the world tells us that if it's a 2-shot dose, you really do need that second shot. So it's critical for everyone getting it to keep that in mind.
And you are seeing that this more contagious variant is also responding to some of the vaccines. That's got to be good news.
Yeah, I think there's been a lot of hype, frankly, about, the decrease in efficacy with these variants. The variants are certainly, we've talked about this, they're certainly concerning. But if the current vaccines do work against them, just not as much as they do against kind of what we've seen in the United States. They're still very effective, and we need to get them out to more people now.
Hey, thanks for watching our YouTube channel. You should know that you can follow today's top stories and breaking news and catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.